Hi, it's Jen Brewer. I'm here today to show how to start a peripheral IV. This is Annie arm. She's just going to show us how we're going to try to find some of these veins and do a hopefully first attempt peripheral IV start. So first thing I'm always going to get is some gloves. If the patient is a bit older and they have it's hard to see some of the veins, we can often wrap up their arms, and that helps to pop and puff those veins up with a nice warm blanket. Also, again, if there's a lot of tissue in the area, using a warm blanket can also be helpful, so we can prepare and do that prior. So for the most part, we're always going to start as low as possible on the hand, because if they're going to have multiple pokes, they'll get one in their AC, but then the IV pump will alarm the majority of the night because every time they take a drink, they bend their elbow. So we try to keep them a bit lower if possible. One of my favorite spots is often in the wrist here, because again, that tends to keep it away from anything obstructing. It is a larger vessel, and it will usually last for quite some time, depending on the types of drugs that we're giving. So wherever we're deciding that we're going to do our site, today I'm going to probably pick right here. We'd only need the tourniquet to go only a short piece away from it. We don't always have to have it way up here to obstruct the blood flow. And we can always get the patient to make a fist as well to help pop and puff off those veins. We don't always need them to do that though. So when we're doing a tourniquet, we're going to wrap it around the patient's arm, and then again we're going to cross it over, and then the one area that you've crossed, we're going to pull up and tuck it. That's going to allow for you to be able to pop this off very quickly afterwards. So again, we're going to do a crossover and tuck and leave it on. So again, the other thing I'm often do is I kind of warm up the patient's hand, hold on to their hand, so that also lets them know that when I'm going to put the IV in, I am able to pull and make the skin taut so that it does insert much easier. I'm going to use a 20 gauge today. We do like to use the Tegaderm IVs because they're a little nicer window. We can use just the plain Tegaderms, but these are actually designed for a peripheral IV. So we open up the package and we leave it there. We are going to need a flush, which I always open so that it's ready. You do always have to prime it because there's a little air in the end. And then we're going to insert that into our cap, or our PRN adapter. And that just goes on by twisting. And then I prime the cap a little bit, and we see a little bit of fluid coming out. So then that's all ready. So now that we've had the tourniquet on for a little bit, as I said, I usually grab the patient's hand. I will often, give it a little rub too, that we're looking where we're going to put the IV in. I use the chlorhexidine, so often I'll actually use two. The first one I'll use to kind of rigorously scrub, because sometimes you'll see there's a lot of dirt on it. There's even a little bit of dirt on our Annie. And then I'll get a second one. I only have one today that I'm actually going to go out in a circle so that the whole area is nice and clean. Then I'm going to open up our intravenous needle. I'm going to grasp from here. I'm going to pull the cap off. And then again, I'm going to get my area where I'm going to insert. So I'm pulling back, I'm pulling down, I'm making the skin nice and taut. And then again, we're going to go at about a 45-degree angle until we get into the vein. So we're going to poke, and then as soon as we tend to see flash come back into the IV catheter, then we can lay down and go flat. And we end up pushing the needle out and away and just allowing the plastic cannula to still receive it inside the vein. So this actually, when it clicks, that means that you can't put the needle back into. But as soon as you're actually in, you also then want to take off the tourniquet so that the patient isn't still feeling tight on them. Once you've got it in, I do our best to try to anchor it. So we're going to hold and pull your gray piece away, which is your needle, and then I grab our bandage. So the backing just comes off, and this little window is you actually want the site that where you've inserted to be visible in that area. The white tape, we can cover the rest of it, and that's going to make it a lot stronger by having that down. So really, where the pink piece ends, that's about right where you're going to put your window. So then that goes down and tapes in. So there is on this side a little area for you to place the tubing so that that flattens. And then just like any other Tegaderm, there is a windowed border of paper that we undo. So there does come two other pieces of tape. One that you're going to write your name and your date on it so that you have that labeled so we know when the next IV should be changed. They should be changed every 3 days. So then once your name and your date is on there, you can proudly display that, look, I got this IV in and it's on. We can use this additional tape to help tape up the IV. But we also want to make sure that we're into the vein and we're going to flush it. So we take off our cap and our line is already primed. Then we're going to put a couple drops in. And again, we should allow the blood to come all the way through the tubing, that we would then just have a little bit of saline at the end, and then we're going to flush it through. And then we're going to clamp it off, and then our IV is ready to use. So then I use this, after that's on, I can use this piece of tape to, again, go around and attach that to the patient. Okay, so then that, by attaching some tape around the back, then it doesn't allow for it to come off. Okay, and that's how we insert a peripheral IV.